Young people are the future of Kenya. When young people have the opportunity to complete their education and find jobs in the skilled workforce, families are healthier and can better contribute to the Kenyan economy. However, unintended pregnancies at an early age are hindering the potential of Kenyan youth and the success of Kenya as a nation. On average, most Kenyan youth have their first sexual encounter by age 18, but they do not marry or begin using contraception until age 22. This gap between age at first sex and use of contraception exposes youth to many risks, including unintended pregnancy and early age at first birth. Nairobi's teenage pregnancy rate is higher than in the neighboring counties. Nearly 1 in 5 girls ages 15 to 19 in Nairobi have had a first birth or are currently pregnant. Increased access to contraceptive information and services can help young women prevent unintended and high-risk pregnancies.
Adolescence is this time where you are getting from being a child to being an adult. It's this point where you need to make decisions.
There's a very big need for a young person to access affordable contraceptive because every decision you make will determine your future.
If young people are not taken care of very well, they end up getting into issues that actually affect their life negatively.
So it's a very critical stage. It's a make it or break it stage for people.
Several national policies and the new Nairobi County Integrated Development Plan support youth access to sexual and reproductive health services that are tailored to their needs.
There's a very big need of ensuring that these services are accessible, are affordable, and are consistent to young people.
However, discussions with Nairobi youth and interviews with key stakeholders reveal the challenges of implementing policies to expand youth access to contraception. Despite a strong policy environment, youth still face many barriers to accessing contraceptive information and services.
Again, when we were having the research with young people in Nairobi, quite a few of them even know what a youth-friendly facility is. In fact, almost none has ever seen one. So we are talking at a scenario where we have the policies, we have the guidelines that were meant for this very young person in Nairobi. Yet this person has no idea even how that facility in itself looks like.
Because of the lack of accessible and accurate information, youth in Nairobi are unaware of the variety of available contraceptive methods and their true side effects. The life skills education curriculum in schools does not provide information on contraception and how to prevent pregnancy. It is not comprehensive. In our class, she only talked about hygiene, so it was up to us to ask questions about sexuality. Most community influencers, including religious leaders, focus on abstinence in their discussions with youth. In fact, some youth do not learn about how to prevent pregnancy until after one of their peers becomes pregnant. If we ask, we get answers, but they do not give us straight answers. They kind of sugarcoat the answers. Younger and unmarried youth have a particularly difficult time obtaining information on contraceptive methods from providers because of judgment or stigma. When you go there, you're told you're still young. They do not want to give you information. They might send you away. Many youth feel they cannot turn to their parents to talk about these issues for fear of disapproval. Those who can find their parents are often reluctant to have these conversations. If your parent is not on board, it's very hard to access. Because of these barriers to accessing contraceptive information, youth frequently look to online sources or peers. You look at the internet rather than talking with parents or anyone else. It's the internet or peers because that's where they feel most comfortable. As a result, numerous myths and misconceptions about contraception are spread, and it is difficult for youth to make informed decisions about their health. Focus groups revealed that youth face similar difficulties while trying to access family planning services at facilities. Affordable sexual and reproductive health services are often available in public spaces frequented by members of the community, exposing young people to judgment and embarrassment.
In some cases, we've had the service providers who are judgmental and they discriminate against them, so they don't feel confident. The other big concern that young people have told us about is the privacy and confidentiality. Sometimes they will go to the same setting where they'll find that even adults are accessing services, and they feel that they don't feel comfortable disclosing the information in such setups. The cost of services is also a barrier to them. The distance, some of the youth centers are located in very far areas where they are not able to access services. And they've also told us that in some of the facilities when they go, they find that they don't have adequate commodities or supplies, and then they have to keep being referred to different areas to go and access services.
If we take a look onto those barriers, each one of them, and try to address them, then probably we stand a chance of making our services more youth-friendly.
I can say we have a need for youth-friendly services in Nairobi County. They are our most active population. These are the people we need to invest in. And to invest in the youth, they have to be healthy.
While contraceptive use in Kenya has steadily increased over the past 4 decades, the youth population in Nairobi is also growing. Additional government investments in youth-friendly services must be made to improve contraception accessibility so it keeps pace with population growth. Counties that increase investments in family planning can expect future savings on costs incurred from unintended pregnancies.
We know that investing 100 shillings in family planning ends up saving a large cost of 220 shillings that are involved in maternal and newborn health. This is due to the prevention of unintended pregnancies when you invest in contraception.
To continue improving sexual and reproductive health information and services for youth, the Nairobi City County Assembly should commit funding from the Nairobi City County Family Planning Budget to improve youth-friendly sexual and reproductive health services, include youth-friendly sexual and reproductive health services in the Nairobi City County Annual Development Plans as a priority focus for budgetary support, advocate for the use of the National Adolescent Sexual Reproductive Health Policy Implementation Framework to develop costed implementation plans for each sub-county that include the recommended activities to expand youth-friendly contraceptive services. Improving access to youth-friendly contraceptive information and services will empower youth to better plan for their education, careers, and families. Investing in young people is an investment in Kenya's future.